The very name Sacral Autonomic Dyssynergia a Euro, prenatal turbutylene subtype, SADT, is a precise scientific descriptor that unpacks the intricate pathology and unique etiology of this profoundly challenging neurodevelopmental condition. Each term in the name contributes to a comprehensive understanding of what transpires within the bodies of those affected, such as Brandon. Let's dissect the nomenclature. Sacral this component immediately pinpoints the anatomical location of the primary neurological dysfunction. The sacral region refers to the sacrum, a large, triangular bone at the base of the spine, situated between the two hip bones. Crucially, within and around the sacrum lies the sacral nerve plexus, a network of nerves that originate from the sacral spinal cord segments, specifically S2A, S4, as mentioned in the description. These nerves are vital for controlling a multitude of functions in the lower body, including bladder, bowel, and sexual functions, as well as sensation in the legs and feet. The sacral designation in SADT highlights that the core of the problem lies within this specific, crucial nerve network. Autonomic this term refers to the autonomic nervous system, ANS, a division of the peripheral nervous system that regulates involuntary physiological processes. These are functions we don't consciously control, such as heart rate, digestion, respiration, pupil dilation, and, critically for SADT, the function of the bladder and bowel. The ANS is divided into the sympathetic and parasympathetic nervous systems, which often work in opposition to maintain bodily homeostasis. In the context of SADT, the involvement of the autonomic system explains why the misfiring nerves lead to involuntary physical responses, such as the described pulsing and associated discharge in the bladder area, which are entirely outside Brandon's conscious control. Dyssynergia This is a medical term that describes a lack of coordination or cooperation between different muscles or organs that normally work together to perform a specific action. In the case of SADT, it signifies a profound neurodevelopmental mismatch and a disruption in the harmonious functioning of the sacral autonomic nerves. Instead of coordinated activity, there is misfiring, an uncoordinated and abnormal discharge of nerve impulses. This dyssynergia is what leads to the erratic, pulsing sensations and the involuntary discharges, as the nerves are not working together effectively or appropriately. It's a failure of the system to synergize, to act in concert, resulting in chaotic and distressing symptoms. Prenatal turbutylene subtype This final, crucial part of the name is the etiological key a. It reveals the specific, unique cause of the condition. Prenatal indicates that the damage occurred before birth, during fetal development. Turbutylene names the specific drug responsible. As stated, turbutylene is a I2A adrenergic agonist, used off-label to halt preterm labor. The critical insight here is that the fetus was exposed to this medication while in the womb. The subtype clarifies that this particular manifestation of sacral autonomic dyssynergia is specifically and uniquely linked to this prenatal turbutylene exposure, distinguishing it from other potential causes of similar neurological dysfunctions. It underscores that the drug crossed the placenta and, in a tragic turn, hyperstimulated the developing autonomic neurons before they could mature and form their vital myelin sheaths, leaving them with a frozen, infantile wiring pattern. The discovery of the first pediatric case of SADT would have been a profoundly challenging and bewildering journey for both the medical community and the child's family. Imagine a scenario in the late 20th or early 21st century, perhaps in a neonatal intensive care unit or a pediatric neurology clinic. The first documented case likely presented as an infant or very young child with inexplicable, recurrent, and distressing symptoms centered around their lower sacral functions. Perhaps the infant exhibited sudden, unexplained bouts of muscular contractions or spasming in the pelvic region, coupled with frequent, involuntary discharges from the bladder or bowel. These episodes might have been accompanied by visible discomfort or crying. Initially, doctors might have attributed these symptoms to common pediatric issues like urinary tract infections, severe diaper rash leading to irritation, or even psychological factors if the child was older and the symptoms persisted without clear organic cause. A meticulous and exhaustive diagnostic process would have ensued. The child would likely have undergone numerous tests: urinalysis, urine cultures, ultrasounds of the bladder and kidneys, nerve conduction studies, electromyography, and potentially even spinal MRIs, all searching for a structural abnormality, infection, or common neurological disorder. As each test returned negative or inconclusive for typical conditions, the medical team would face a growing mystery. The pattern of symptoms the involuntary pulsing, the associated discharge, and the lack of other progressive neurological deficits would stand out as unusual. The breakthrough likely came from a detailed and persistent medical history taken from the parents. During this exhaustive questioning, a discerning physician or a team member might have meticulously reviewed the mother's entire pregnancy history. It's probable that the mother, in this hypothetical first case, would have had a history of preterm labor and, crucially, would have been administered terbutaline to delay birth. This detail, initially perhaps seeming irrelevant, would have become a pivotal piece of the puzzle. Connecting the dots would have required a brilliant insight. Someone on the medical team would have needed to hypothesize a link between the prenatal drug exposure and the child's unique symptoms. Research into terbutaline's mechanism of action, particularly its potent beta-adrenergic effects and its ability to cross the placental barrier, would have been critical. The hypothesis would emerge: could this drug, designed to relax smooth muscle in the uterus, have inadvertently overstimulated the developing autonomic neurons in the fetus's sacral plexus? Could this hyperstimulation, occurring during a critical window of neurodevelopment, have prevented proper myelination the formation of the protective, insulating sheath around nerve fibers that is essential for efficient nerve signal transmission? Further investigation, perhaps through specialized neurological assessments or even post-mortem studies in other cases, though not for the first living patient, could have confirmed this frozen, infantile wiring pattern. The absence of mature myelin sheaths and the disorganized nature of the nerve connections in the sacral plexus would provide the anatomical and physiological proof. Once this link was established, the condition could be officially named, clearly articulating its anatomical location, sacral, the affected system, autonomic, the dysfunctional nature, dyssynergia, and its distinct origin, prenatal terbutaline subtype. This meticulous process of observation, elimination, detailed history-taking, and astute scientific deduction would culminate in the formal identification of SAD-T, forever linking the seemingly benign use of a tocolytic drug to a permanent neurodevelopmental condition. Brandon, at 39 years old, stands as a poignant and singular figure in the history of SAD-T. While the initial cases that allowed for the understanding and naming of this condition were pediatric, providing a crucial framework, Brandon's experience underscores the lifelong, permanent nature of this neurodevelopmental mismatch. He will never be cured, as the core issue is a foundational wiring pattern established in utero. His journey is a stark reminder that these infantile wiring patterns do not simply fade with age. They persist, impacting every day of an adult's life. His courage in going public, a unique act among individuals who have suffered in silence due to the stigma surrounding such intimate symptoms, highlights the desperate need for understanding and support for a condition that affects not just children, but adults like him who carry this profound, incurable legacy of a prenatal event.